Should or should we not market to the public as oral surgeons? That's a question. I get it all the time. The answer is a resounding yes, and I'm going to tell you why in 1 second. I'm Bart Nellinger. This is Progressive Dental. Here we go. Guys, that's a question I get all the time from oral surgeons, not just from oral surgeons, but all dental specialists. But I get this question all the time. It's Bart, should we be advertising to the public? Are we going to lose referrals if we start advertising to the public? When is the right time, and should we be doing this or not? And as far as oral surgeons go, I say the reason why I give you a resounding yes is specifically for the dental implant market. Let's be honest. Oral surgeons are probably the last one to the game. The general dentists, they've always had to market, right? Because they're the ones getting the patients, referring them out. I think periodontists came right after general dentists, specifically for dental implants, because the periodontists lost more of the patients that were being referred earlier. The reason why oral surgeons haven't jumped on to the marketing scene in the same way as periodontists and prosthodontists is because they haven't really lost their trauma cases. You haven't really lost third molar extractions and things like that to GPs, which makes up a pretty significant portion of the practice. But the reason why I say a resounding yes, because if you want to be relevant at all in terms of the dental implant market, if you want to do dental implants, if you want to place them, if you want to do full arch implants, big complicated cases like that, then you're almost to the point where if you're not doing it right now, that you're behind. You're going to be losing market share. It's getting so competitive out there, and as an oral surgeon, you have so many competitive advantages to offer to the public, and they just don't know. So perception is reality when it comes to marketing. They only know what they see. When they go online and they search best dental implant doctor in Tampa, right? Are they going to find an oral surgeon? Are they going to find a bunch of general dentists? Who knows? Whoever they find, perception is reality. But for the most part, they don't find a whole lot of information in regards to oral surgeons. So absolutely, when it comes to dental implants, that's the biggest piece of the pie that you are going to lose in terms of referrals in the future. And the clients that we have, out of 800 clients or so, we've got probably 60%, maybe more, are specialists. And it seems like the business model for GPs with implants and specialists for implants, it's all going to the same area. It's all going to the same place, right? Which is multidisciplinary, all under one roof way of delivering implants. But as an oral surgeon, you can say things and you can advertise ways that other people can't. You've got so many advantages, starting with patients that are medically compromised. You've got significant advantages from a sedation standpoint. You've got advantages from a training standpoint. You've got advantages from just in terms of typically the number of dental implants that you place is higher. Your ability to handle more complicated cases, patients with severe bone loss, significant bone loss that other doctors don't want to do. And let's face it, what happens when dental implant cases go bad? What happens when they get messed up and the implants are failing? Where do they go? Right? Who do the other doctors pick up the phone to call when something goes wrong? They call the oral surgeons. So it's a situation where we don't do a whole lot of marketing for direct to the public for third molars, because for the most part, oral surgeons haven't lost a third molar business. So you're still going to get it from referrals no matter what. They don't want to mess with it. You haven't really lost a facial trauma type business, the jaw surgeries, things like that. General dentists aren't going to go and do it, but with the advent of digital guided surgery, with the progression of robotics and all of these, all this technology that's making the surgery more predictable and easier for dentists to adopt it. Now they're able to do cases they wouldn't have touched 7, 8, 9, 10 years ago. So the question is, why are you not already advertising aggressively direct to the public to secure your marketplace and secure your foothold in your own market? Plus, you're the oral surgeon, you're the specialist. Shouldn't they be coming to you for a second opinion before making a decision to spend $30,000, $40,000, $50,000 on a surgical case? I think so. And I've never, ever, and we've been in business since 2009, I've never had a situation where we advertise direct to the public and an oral surgeon or a periodontist called me and said, turn it off, turn off the marketing, we just lost an A referral. I've never heard of it. It never happens. If anything, it helps them because it gives you the ability to cross-refer a lot more, right? You can only cross-refer word of mouth if you're not doing any advertising at all. So absolutely. Anyone that says otherwise, super old school mentality, stuck in the past, probably with an academic book in their hand, don't pay any attention to it. Those referrals are not going to increase in the future. If you want to do big dental implant cases, you want to do full arch dentistry, you're going to have to learn and become good at advertising your business and closing the cases, closing the direct to public cases.